So good morning, everyone. And I just would like to echo Prof Moodley's excitement at the ability to be able to present at the 9th annual ARESA Research Ethics Seminars. In my years of attending the seminars, they have all been wonderful events, and it's such a privilege to be able to contribute to some of the discussion today. And I really look forward to sharing some of our preliminary research findings from some work we've done around ethical issues in public health emergency research in South Africa, and obviously with the focus on COVID-19. I would just like to acknowledge both Prof Moodley and Prof Rennie as the colleagues who are involved in this project. So just to thank and acknowledge their support. So just to start with a brief background, and this is going to be, nothing new to all of us who have experienced and lived in these very difficult and terrible, times over the last 18 months. And certainly, as research ethics committee members, I think all of us have experienced the numerous challenges that research ethics committees have faced with needing to conduct and review research during COVID-19. And of course, most of the tensions that we experience have been around balancing the urgency of review of COVID-19 research with very careful ethical deliberation, particularly around the risks and benefits, and often having to deliberate around many unknowns or very new research, or where perhaps the science had not been completely well established in peer-reviewed research going before. So I think that commonality that we share is something to acknowledge. I think also, within the South African context, we have a historical mistrust of research, and certainly that has been seen to play out in vaccine hesitancy and around suspicion around much of the COVID-19 research and the resultant development of vaccines thereafter. In South Africa, we've also been, as research ethics committees, we've also been affected by, certainly, within 2020, by the critical absence of the National Health Research Ethics Council. The NHREC was not reconstituted in November of 2019, and was only and council members were only reappointed at the very end of 2020. So that left a year of critical research ethics development within COVID-19, where we lacked national guidance and oversight. So I think that is something also important to acknowledge. Also, just to say that, what led us to do this research was that we recognize that the current ethics guidelines for research during public health emergencies do not specifically address the complexities of contextual issues in middle to low income countries. And that is interesting. This refers to specifically guidelines from the World Health Organization. There's a very good guidance document from the Nuffield Council. And although some of these have been developed around the Ebola the Africa Ebola crisis, interestingly enough, many of the contextual issues for low to middle income countries have not been considered. And I think within South Africa, we've also seen complexities during COVID-19 emerge. For example, you're having to deal with national vaccine rollout through a phase 3B implementation study was certainly an interesting challenge that research ethics committees were faced with. So in terms of our research, what we aimed to do was to explore the perspectives and experiences of research ethics committees regarding the procedural and ethical challenges of COVID-19 research in South Africa. So just to briefly give some input on our methods, we naturally obtained ethics approval both from Stellenbosch University and the University of Cape Town. We also obtained appropriate institutional approvals before conducting interviews, and obviously all participants were asked to give written informed consent before we commenced studies. We conducted in-depth interviews with 21 research ethics committee chairs or members from 7 research ethics committees. And these research ethics committees were based at large academic health institutions across South Africa and were actively involved in the review of COVID-19 related research. We purposefully sampled research ethics committee chairs and members, and we conducted interviews between January and April of this year. We used Zoom to conduct interviews, obviously to ensure that our research was appropriately conducted within the context of a pandemic. And interviews generally ranged from 60 minutes to 125 minutes. And we conducted interviews until data saturation was achieved. In the interviews, we explored issues around Research Ethics Committee meeting processes during the pandemic, standard operating procedures, and review processes. We also asked participants to give their insights around ethical issues associated with COVID-19 research, as well as issues around reciprocal review and harmonization of Research Ethics Committee reviews. Our interviews were recorded and were transcribed verbatim, and line-by-line coding was then performed. And we used an inductive approach to thematic analysis to analyze the data from our interviews. Just to mention that our Research Ethics Committee participants, their backgrounds included laboratory scientists, colleagues who had experience in clinical trial research themselves. We had a number of frontline workers who were working in academic, public and private health services, in addition to serving on the research ethics committees. And colleagues had varying degrees of experience and qualifications in bioethics and research ethics. Our participants also had diverse experience on serving on RECs, and this was between 2 to 25 years of experience in research ethics committee work. We did not collect any other demographic information to maintain the confidentiality of our participants. So moving on to our results, and I must apologize in advance that the next few slides, apologies, are a little bit information dense, but I will take the time to unpack the information and to explain some of our key findings. So with our results, we identified 3 broad categories and 9 main themes during our qualitative analysis from the interview data. And our broad categories were really fundamentally around research ethics processes and procedures, critical research ethics issues that were identified during the review of COVID-19 research, as well as health equity issues. And with the 9 themes that you can see on this slide, I will unpack these per category in subsequent slides. So for Research Ethics Committee processes and procedures, a number of themes and sub-themes were developed. So we identified 3 main themes related to processes and procedures. And the first key theme was coping during COVID-19. I think many participants viewed their involvement in Research Ethics Committee work as their contribution to efforts to fight COVID-19. And there was certainly, a very strong sense of solidarity, and the public good associated with Research Ethics Committee work was reported. But the strain associated with Research Ethics Committee work was also highlighted during COVID-19. A significant increase in workload was reported, often in conjunction with administrative challenges associated with remote working conditions. We also identified key issues around the importance of leadership and support for research ethics work. For the theme, innovation during vulnerable pandemic times, it was noteworthy that innovative practices were adopted to facilitate the review of COVID-19 research. And this was done to maintain rigor of research ethics reviews during a COVID-19 urgency. This also included often a triage approach to reviewing COVID-19 research to optimize availability of reviewers and to reduce the review burden on committee members. There were also challenges associated with the shift from physical to virtual REC meetings, and this was particularly noted around the effort needed to maintain rigor in research ethics discourse and full engagement of the committee in deliberations around protocols for research ethics review. Importantly, it was seen that the absence of the national research ethics governance and guidance due to the absence of the NHREG forced RECs to work collaboratively. This resulted in the innovative development of a national ad hoc group, Research Ethics Support in COVID-19 pandemic, also known as RESCOP, and this allowed the sharing of resources and support for COVID-19 research. When considering the potential for reciprocal review and harmonization of South African research ethics review processes, the majority of participants expressed caution. The context was rarely identified as key, and the exploitation of human rights abuses that are embedded within South Africa's history were seen as critical factors. There was a strong need, or rather a strong recognition for the importance of trust in REC review processes and the need to promote community building and knowledge exchange between RECs. So then moving on to research ethics issues, and I think what you can see from this slide is that committee members really and chairs really identified a wealth of research ethics issues that were experienced by the committee. I'm going to highlight the main points, because I think to unpack this alone would take a very long time. So forgive me for touching on the important issues, and I hope we can unpack them in the discussion. A central theme throughout the interviews was clearly that the research ethics landscape is rapidly evolving during COVID-19. In addition, the risk-benefit analysis was seen as a moving target, with changes in excess death rates, pandemic waves, rapidly emerging evidence, and national vaccine rollout plans all intersecting and making deliberations complex. Other key sub-themes were around placebo use and equipoise, challenges to unblinding, and the expanding knowledge base, and very importantly, the experiential learning of research ethics committees, particularly around implementation research in a pandemic. The majority of participants highlighted the absolute extreme vulnerability of participants, and this was seen at both individual and population levels. Widespread preventative and therapeutic misconception was a critical sub-theme, with many factors contributing to misconception. Stigmatization and prejudice were commonly identified social harms. There were also unique challenges to informed consent, and this was really a key theme. Participants highlighted the effects of fear associated with COVID-19 infection, desperation for an effective vaccination or cure, and isolation from partners or family members on the validity of informed consent. The importance of really understanding the reality of the clinical environment during the pandemic and what was feasibly possible in terms of socially distanced consent processes was emphasized. The impacts on individual autonomy during this time were important concerns. And participants also had divergent views on if and when consent waivers were permissible. The other key theme we identified was around the challenges to community engagement during COVID-19. And interestingly, participants identified two sub-themes related to stakeholder engagement. The first sub-theme was the REC's own role in stakeholder engagement, particularly during the COVID-19 pandemic. And the second sub-theme related to challenges associated with ensuring rigorous or authentic community engagement in the context of a pandemic. I think this was probably best described by one participant as going down a rabbit hole, and the need to further unpack the ethical requirements of community engagement during the pandemic are very clear. Lastly, our other critical theme was around health equity issues. And one of the main themes that emerged was the unintended consequences associated with the prioritization of COVID-19 research. Ethical issues associated with broad funding and publication pressures were identified within the very complex South African context. There was a widening of research gaps in other vulnerable groups and related inequitable access to research and sometimes healthcare services. A consistent example that was shared was the halting of non-COVID related research during national lockdown. And this was particularly around, this included initially, obviously, therapeutic trials, HIV and TB research. And critical social sciences and educational research were not prioritized, with many participants expressing awareness that this may have contributed to increased health-related inequities and structural social harms. The other main theme we identified was the boundaries between research ethics issues and the ethical issues of public health emergencies. Significant pressures were experienced with pausing both with COVID-19 and non-COVID-19 research, and research ethics committees often needed to find a careful balance between looking after participants in research that was allowed to continue during pandemic times and with stopping studies that might have had benefit to participants. RECs also needed to look to unique ways to allow safe follow-up of participants. Another common issue that impacted on health equity were arrangements for post-trial vaccine access and how this was negotiated in the context of a pandemic. RECs also experienced the blurring of lines between research ethics obligations and the obligation to contribute to the common purpose of improving the quality and value of clinical care and health systems during a pandemic. This was often seen as being compounded by the dual role of REC members as frontline healthcare workers, or even just as community members and individuals experiencing a public health emergency firsthand. The scope and mandate of RECs were also important considerations here. So what have we learned? And with learning, I think there always comes more questions. So we clearly identified that RECs are resilient and adaptable, but with these changes experienced around COVID-19, I think the question is, what precedents have been set in terms of review turnaround times, and are these sustainable as we see the pandemic continuing? Also, ought RECs to maintain a rapid review process for COVID-19 research as the pandemic continues? And how does this impact on non-COVID research and public health more broadly? Reviewer and REC fatigue are real factors, and so how do we think about maintaining engagement with ethical issues and the depth of REC discourse in and between REC meetings? So I think also just one of the important issues arising from our work is we clearly identified that RECs have been very rigorous in their review of COVID-19 research. But perhaps a question to ask is, has REC decision-making been too strongly guided by the manual aid paradigm? This paradigm, as we know, is used consistently by research ethics committees in South Africa. It appears in many SOPs and is in our national guidelines. But this paradigm is often criticized as being too biomedically focused with an emphasis on clinical trials. So one of our questions is it possible for RECs to adopt a public health research ethics paradigm or lens to give more weight to the context of community or population interests? And this might be thinking about considerations around social justice, reciprocity, and importantly, relational autonomy, the individual within communities and obviously broader populations. So in terms of our recommendations that we have from this preliminary work, we've clearly identified that the rapidly evolving nature of COVID-19 research really indicates that ongoing empirical research is essential. We do need to have some comparative analysis between different African countries to develop the discourse around African RECs and COVID-19 research ethics issues. And I'm really hoping that this seminar will be the first step towards that. And importantly, we need to rapidly translate the findings of research into research ethics practice. And we are hoping that, the empirical work that is happening can inform development of national COVID-19 research ethics guidelines, to develop mechanisms to strengthen relationships and collaborations between RECs, and critically, to really build on research ethics teaching and training, especially around informed consent. So finally, just a concluding remark and thanks. I think I'm sort of borrowing from the words of Pellegrino and Tomasma, who said that who used the words calm, wise, and responsive in terms of governance. And so from this work and from the deep insights shared, I really think that REC should strive to be calm, wise, and responsive to the ethical challenges of COVID-19 research. I would just like to really acknowledge all of the REC colleagues who took part in the study. Thanks so much for your time and generosity. To Prof Moody's and Prof Rainey, Prof Mark Blockman, and our research assistants. Thank you.